everyone, it's Christy. I haven't did a video in a couple of weeks, but I've had a lot going on with work, and I was, I guess, a little discouraged because I, hadn't had my fill yet, and was able to eat pretty much anything I wanted to, and hadn't really lost much weight. I did end up losing another pound during the time of not having any restrictions, so that was good. But so what I'm going to talk about today is two different things. One, I'm going to talk about my fill because I got my first fill yesterday, and I want to talk about rules to the lap band because there seems to be so many different rules for everybody, and doctors are different, and I'm just going to tell you about my doctor's rules and the way I feel about all the other rules that people say they have to adhere to. Excuse me for the way I look. I am off work today, so I just woke up. I'm still drinking my coffee and trying to um, get my day together. So, sorry. And by the way, coffee, if anybody drinks coffee, I drink my coffee and I put cinnamon or apple pie spice in my coffee, and it's fabulous. It helps flavor it up so you don't have to buy those, fatty Starbucks coffees and things like that. So you might want to try it. I do regular coffee. I like Equal in my coffee or Splenda, and I do a little bit of powdered creamer. I don't like liquid milk creamer. I like powdered creamer. And then I put a little bit of cinnamon, ground cinnamon, or the apple pie spice is what I've been using lately. Kind of get into the fall and the winter mode. So, okay. All right. So, banded on August 31st. That's about 5 weeks ago. Um, was 254 at pre-op. Got down to 249 in a week. I was 249 day of surgery. And since surgery, 5 weeks, today, I am 241 pounds. So that is 13, 14 pounds since a week before surgery. I did start out at 272 December of last year on my first visit to my doctor. So, and I'm 241 now, so I have lost 31 pounds since December of last year. That's very good for me because I'm not a lose weight type person. I might lose a few here and then gain, and then it's all over with. So, there we go with that. Okay, so I go in yesterday for my fill, nervous as I could be. I've heard different things from different people. I'll tell you my experience. My surgeon is really nice and he's really good, but he's fast. And he, is always in a hurry, and he's like, blah, 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 and I understand. He's a surgeon. I mean, come on, I'm a registered nurse. I work in the nursing field, in the medical field, so I know people are in a hurry. But I do want to say that as a patient, you have a right to ask questions and get your questions answered. So I was so nervous yesterday that I basically just told my surgeon, I said, look, I know you're in a hurry and I know your time is busy, but I really need you to slow down and talk to me today because I have questions and I'm nervous. So, saying that to him, I think triggers, something in their head. And he's like, okay, you're correct, Chrissy. And he pulls up a chair and sits down, what's your questions? So I asked him, all my questions, and I started with the rules. And I said, well, every time I come into the office, they give me a paper, and this is it right here, rules for the lap band. I get this paper every time I go to the surgeon, whether it's just follow-up, fill, weigh-in, whatever, they give me this paper every time. So on my paper, it says rules for the lap band. 1, eat solid food. Eat 3 meals a day. Keep your weights once a week and only once a week. And your pouch is the size of a golf ball that never changes. Then it says rules of liquids. No liquids with your meal, no liquids as your meal, no liquids with calories between meals. No liquids with your meal and at least 1.5 hours after a meal. If you go longer than that, it is even better. No liquids as your meal. Soups are liquids. Chili is a liquid, and oatmeal in the morning is a liquid. General rule. If you have to ask, is this a liquid or not? It probably is a liquid. If you have to use a spoon to eat it, it is a liquid. No liquids with calories between meal. No sweet tea, regular colas, orange juice, apple juice, milk, or protein shakes. You may have diet colas. Some people leave them open for 10 minutes to release carbonation. A typical breakfast, a protein bar, or a small muffin, or half a piece of toast with butter and jelly. A meal should take no longer than 20 minutes. If you are taking longer to eat, then you are probably trying to out-eat the band. Heartburn at night means the band is too tight. Call us immediately. That is what is written on my rules that I get every time I go to the bariatric center at the surgeon's office. Now, my questions for my surgeon yesterday were, since I've been on YouTube and I've watched a lot of banders on here, people that have been banded, I've heard a lot about rules. I hear that my doctor says no carbs, no breads, no pastas, no Diet Cokes, 60 to 80 grams of protein a day, 1,000 calories a day. Don't eat for 30 minutes after the meal. I hear all these different rules. So I asked my doctor yesterday, I'm like, how come your rules are so different and other people's rules are different too? And of course, he tells me these are the rules that they come up with. I said, well, do I need to eat 60 to 80 grams of protein a day? Should I stay on 1,000 to 1,200 calories a day? And he looked right at me and he said, you do what you want to do. He said, but the lap band is a tool. It's not meant to torture you. He said, you don't need to count calories. He said, if you stick to those rules and you eat 3 small meals a day, stop when you're full, don't eat in between your meals, he said you are going to lose weight. Now, he says it depends on you. If you want to lose more, you can eat differently, watch what you eat, exercise. He doesn't even say that I have to exercise. He says that he has program patients that, do this and they don't exercise. He said it's good to exercise, for skin tone purposes, things like that, cardio for your heart. But he said it's not a necessity, that I'm still going to lose weight even if I don't do all that strict stuff. So I said, well, okay. He tells me, counting calories, weighing food, worrying about this, worrying about that. It's too much like dieting, and people get discouraged. He says to me, he said, I need to take it one day at a time. I need to eat what I want, but I need to make good choices. Chew small, eat small, swallow, don't drink after I eat, and don't eat in between meals. And he says, try that, doesn't work, then change up your rules to something that you've heard on YouTube. But basically he's saying don't torture yourself. Don't make it something that is going to be too difficult for you to follow. The weight with the lap band is not meant to come off fast. It's meant to come off 1 to 2 pounds a week, which is better for you, healthier for you, and it's going to stay off longer it's going to stay off in the long run if you lose it slower. So those were the rules that he told me, and that was the reasoning for the things that he told me. I know I see people on YouTube that are beating themselves up because they didn't get to the gym, 3 days out of the week, or because they didn't count calories, or because this or that, or yada yada. I don't know what's going to work for me. I'm going to try what my doctor said based on these rules that I get there. And if it doesn't work, then maybe I'll change it up to where I am counting calories or this or that. But for now, I've basically been eating what I wanted, what I want to eat since my surgery and all my swelling has went down. But I've been better portion control and at least trying to avoid white breads, white rices, pasta, and any fried foods. And I have continued to lose weight without any saline in my band. So I don't think that any of the rules that I'm following are per se wrong. Just maybe not what some other people say. I'm going to try to make it as easy as possible for myself because I don't want to feel miserable, and I want to enjoy my lap band, enjoy my life, and not feel like, I'm gone from worrying about being overweight to worrying about how many calories and protein I get in my body every day. So, second part, the fill. How did the fill go? The fill was fine. He tells me to lay down on the table, raise my shirt up. He tells me to raise up like a sit-up, tighten my stomach. He feels for my port, wipes it off, sticks me, numbs me, has me sit up on the side of the little table, gives me some water, says drink, 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 drink until you feel it come up to here. I drink, it comes up to here. I tell him. He stops. He says, now take several drinks of water and tell me when that pain goes away. Did that. The pain went away. And he said, there you go. You're all done. He put 3 cc's in my band. I have a regular AP standard band. He put 3 cc's in, which he said is pretty typical. He said it might take 2 to 3 fills to get me to my what they call sweet spot. So I have 3 cc's in my band. I'm on liquids, full liquids for 48 hours, and then I can go back to regular food. And he told me to come back in 4 weeks and see where we're at. So that's my update, and that's my take on the rules for the lap band and how my first fill went. I hope everybody else is doing okay, and I hope no one is offended about the whole rule thing. I'm just saying that I watch a lot of videos that said if you don't follow the rules, you don't follow the rules, you don't follow the rules, you're not gonna lose weight, you're not gonna lose weight, and I don't necessarily think that's true. I think it's what works for the individual. I think we're all different, and I think you have to make this experience be what it is for you and what makes you happy and content with having the lap band. Right now, I don't choose to run to the gym 5 days a week. I don't have time to do that. I've never been a big exercise person. I do have a treadmill, and I am going to, try to walk on the treadmill 3 or 4 times a week for a half an hour. I'm not going to count calories, and I'm not going to count proteins. I'm going to eat my three small meals a day. I'm going to avoid drinking after I eat, and I'm going to see where that gets me. And I'll let you know along my journey. Now that I do have a fill-in, I will make another video next week for update. And I hope everybody's doing okay. If you have any questions, let me know, and God bless to all. Thanks. Bye-bye.